Yes.
Naughty kids. And then after that, he messaged my father and say, can I come over? Can you come here to pick me up? When my sister.
All right, if you want to pull up the if you want to pull this up on your own tablets and that, it's DNW2. Otherwise, let's go through it together. Okay, so I'm required to teach you how to process X-rays manually. There are a few practices that still do this, but it's quite an outdated practice. As most of you have said, the training guide has changed every, 5-6 years. They change what we have to teach for a trade. What the course outline is, and they've actually dropped learning this because it's just not done anymore. Tanya, do you remember doing it manually back when you worked? Yep. So see these 3 lovely boxes on the side here? We would put our hands in there in a dark room and process the X-rays ourselves by using fixer and developer and water. So you will learn how to do that, which is very cool. Carolina, is that how you did it?
I will have this in my country.
Yeah, yeah. Any digital X-rays or mostly that or just that? Just that. Beautiful. It's quite an achievement. Like, I do miss doing that. Oh, the admin talking to me. Yeah, I like doing it because then you've developed an X-ray and that's pretty cool. Okay. So it changes the latent image on the exposed film into a radiograph by producing a visible image on the film. Now, the fixer and developer both do different things. Okay. So we start off with a blank film. Now that film must be stored in a dark place and they have use by dates. So we store them in a drawer, and when we stock them, we put the ones going out of date the soonest at the front and the other ones at the back, because we don't want to get to the back and have ones that are out of date because it can disrupt the clear image that we want to have. That's very important knowledge that you'll need for your exam, so write that down. Why do you think we can't leave unexposed film on this lovely ledge here? The light. Yeah, the light will distort the film before we even process it. After we take an X-ray, what conditions do you think we would keep the film in? Yeah. So in a file, dark in a filing cabinet. Yeah, we wouldn't have it hanging in the window for a week because...
That's right, it's all coming back to me now. We used to put them on little clips and
yes,
hang them up to dry.
That's right, it's quite a long process. In the slip, in the file. Yeah, so we're all going to do a lot of that today. We're going to mount some X-rays in the correct order of what they should be in the dentition, learn how to diagnose problems that are in the X-ray. I'm going to give you some and say, what can you see? Can you see caries? Can you see an amalgam? Can you see a fissure sealant? What do you see? What tooth is this? Okay, so it's easier than what you think, and you'll be so proud of yourself by the time you leave today. So this is what an X-ray film is made of if you unwrapped it. We have an aluminium layer, a black carbon layer, like carbon as in carbon copy paper, a bit like articulating paper. And then we have the outer plastic covering. Now the outer plastic covering is for what, do you think? Protection from what? No?
Because you're going to put it into the mouth.
Germs, well done, good, yeah, oral hygiene. So that's basically, again, we normally sometimes even cover them again with another plastic
and
cover.
when we touch it and maybe the picture is X-ray is not clear.
Perfect, it's very, yeah. Once we unwrap all these layers, good. Once we unwrap all these layers to process our X-ray, we must never hold it like this because we get fingerprints on it. And I've seen it, the X-ray comes out and you can't see the tooth, but you got a lovely print of your finger. There's so many things that can go funny with X-rays. So we handle it by touching the edges like this or using a special clip on that dot. Can everyone see that dot? No?
Covering it.
There's a tiny little indented dot. This afternoon we'll get to play with some real ones and you can all pull them apart, have a play, have a boogie, have a dance. So that dot is used for a number of two reasons. One, that dot's already there, so we can get our special clip Tanya was talking about and clip it there. When we take the X-ray, that dot will always point to the middle of the mouth, okay? So it's diagnostic as well. So if we're a bit confused whether it's an upper or lower that we've taken, we look where the dot is. Also, we know not to take the X-ray where that dot is. So we won't put anything, we need to diagnose where that dot is. Does that make sense? I'm not going to put that dot right in the middle of the tooth that I want to have an internal picture of because the dot's going to disrupt it. I'm going to see that dot and go, what's that dot? So that dot there's for a few different reasons. Because it's already there, we can put our clip on it. If we can't figure out which way the X-ray goes, we look where the dot is. Okay, so it's just like a little, it's like a little raised pimple on it. Yeah. Tanya's like, oh, it's all coming back to me now. I know. So here we go. This is the layers that we spoke about. So we have our waterproof outer package. Again, that helps with our infection control. Our black carbon paper, that helps with blocking out extra light. Okay. They have a second reason when the X-ray beam hits it, but we'll go through that later. The actual film, which captures the image that we need. Lead foil backing. The lead foil backing absorbs some radiation so we don't have scatter radiation. Again, don't stress too much because as each slide goes through, it's going to make more sense. And our waterproof outer packaging, which it's already talked about. And we'll have a play with that. So these are ring kits. This is what I was talking about. By the time you leave today, I will be able to say to you, set up for a 2-3, and you'll know exactly which one to set up. I promise you.
What do you call them?
Rin. So ring kits, R-I-N-N. Now, ring kits are really popular with new graduates. I want to say new graduate dentists because they do the job for you. I have sat my extra qualification so I can actually take X-rays if you guys were interested in that when you finished your course. At the moment with this course you can only assist with X-rays, okay? You cannot independently take an X-ray. So I used these for probably about 6 years and now I use what we call an alligator clip. What makes these so much easier for a dentist or someone who's not sure is the X-ray tube that we point at your face. We line it up with that circle and this special thing guides that beam directly where we need to in the film. Okay? Does anyone not understand what I'm saying?
No, I don't understand.
No? So what we have, if everyone turns around to this surgery here, this is what I'm going to use to take the picture. Okay?
Yeah.
And this circle here will line up on top of the circle on either a blue, yellow or red ring kit. And that directs where the beam of radiation comes out of that end of that tube. The beam of radiation will hit the film, which sits in that bit, exactly where it needs to. This does all the work. There are other holders you have where you have to guess where to put it. Okay? Because if we take an X-ray at an angle like this, we shorten the tooth. Yeah? Does that make sense? Yeah. We need to hit it exactly on to get an accurate picture of that tooth. Okay? If we go from this way, we might make the tooth look shorter. We may distort it. So it has to hit at the right spot. So ring kits are very popular. Okay? These ones here are called crocodile clips because they look like a crocodile with teeth. In America, they call them alligator clips. Some dentists call them by their actual name, which is a snapex. Okay, I'm going to pass some around now. How easy to remember? A crocodile goes snap. So it's a snapex. Snap X. I'll write it on the board for you. I'm going to pass some around. These are all the fun things we're going to play with this afternoon. I love how people play. So as you can see, it's got little sharp teeth. I'm doing my Kylie Jenner again. Little sharp teeth. Snap, snap, snap. I'm a crocodile. Actually, that wasn't a very good crocodile voice. I'm a crocodile. So it's got little sharp teeth to hold the film. So it goes snap, snap, snap X, or it's a crocodile clip. Okay, or alligator clip. So I'll pass some around so you can all have a look. I might pass around, sorry, not that. I might pass around, and again, with these, they come in different colours. It means nothing. It doesn't matter what colour these are. That doesn't indicate anything. They're all the same. I wish they didn't do that because it confuses my students because the other ones, it does matter with the colour. Okay. I'm also going to pass around a film so you can have a look at that little dot, that little pink that I spoke about. Okay. So, I'm going to pass around a box of film and I want you to see if you can identify where that little pimply bit is. That dot that helps us identify.
Do you use this one? No. So how does it Oh, so you
Yes, the whole slideshow is, and I'm recording me talking right now.
So we put the...
I'll go through this. Don't worry about too much about where the film goes. So see if you can identify where that little pimply bit is on there, on the film. That helps us know what way the film goes, and also somewhere for us to hold it where we're not going to damage the image. Okay.
So does the whole...
I'll show this afternoon when we sit down in front of the dragons to take their x-rays, I'll show you where the film goes in all the holders. Fazana liked something. Okay, so these amazing boxes, I might bring it at the front so everyone's necks don't hurt. So this box will be in a dark room. So in our government dental clinics, they still use these.
It's kind of like what's in the box and you have something in there that you
What's
don't
in
know,
the box
and then
today? Is that Jimmy Giggle?
I have no
For all the mums out there. So this will be in a dark room. The room has no windows. If they are completely sealed. Normally has a tiny bit of red or blue light, so we have sun vision. It's also a temperature controlled room. Okay, normally in the middle of all the surgeries, and you go in there to take to process your X-rays. Okay, so for infection control, we would have the X-rays just come out the mouth with our dirty gloves. We would have a clean hand and our dirty hand. Okay, we want to add 2 dirty hands. We want to take the outer layer off and drop it in the dark room and dispose of that. Now we can wash our hands. We want to put on clean gloves to go in here because we're working with chemicals. So I'll go through that again. The dentist has taken the X-ray and given us the film. It's still got the cover on, so we can do this if we wanted to, but you wouldn't. Walk through. If I can get in the room, I do that. Otherwise, clean hand, dirty hand. My 2 dirty hands, I'm opening the outer layer and dropping the inside contents, all those layers, onto my clean bench. I'm disposing gloves, wash hands, and clean. I now want clean gloves so I can start the process, okay? Yeah? Does anyone want me to do that again?
Yes, please.
Yeah?
Yep.
So our dentist, we're in the room. We've helped. We've stepped outside. We've pushed the button. We've got gloves on. So at the moment we're clean. But now the dentist has handed us the X-ray film that has just come out the patient's mouth. As soon as that touches us, we're dirty. So then we're going to chop down the hole, go into our dark room, shut the door, whatever, hygienically, and we're going to want to get the dirty outer plastic layer I spoke about off. So it has a little tear in it. We can tear it open, drop it on the bench. I still haven't touched anything with my dirty hands or that dirty outer layer. I've dropped the clean layer that was completely sealed on my bench, which is all clean. I've put that in the bin. I've taken my dirty gloves off. I will then wash my hands and I'll re-glove. And now I'm clean and I'm ready to process this X-ray.
That makes sense.
Yeah.
That makes sense, yeah?
Yep.
Infection control, but
Yep.
in the surgery they don't
No.
teach us
So
like that. They showed us like different way and
yeah. Yeah. So always with infection control in surgeries, do what you've been taught, okay? And what's
So you're talking about chemicals, like the film has chemicals, yeah, of course.
so the chemicals are in here that we're going to now use to make the X-ray image appear. So now we've got our clean little X-ray there and we're going to work inside our box. This is red so we can see what we're doing and it's not going to disturb the image process. Okay? So actually ignore this picture here. This one's a different one. Let me go down to... That's an automatic one.
So how long did they use this for?
I'm still using it in government dental.
Oh yeah, true.
This is like the original. Okay, so in here, actually there we go. There you go, Tanya. Here's your little clip. Lost that.
Thing on the floor.
Oh yeah, that's what I want. So someone kindly in the other classes left all the layers out for us. That's all right, we're putting it on. So we have 4 containers that are in here. We have the first one is developer. Okay, developer. The second one is water. It's not tap water. It's got too many things in tap water. It'll distort our image. It is purified water, the same sterile water that we would use in our autoclave. Okay. Then we've got our fixer. And then we've got another container of water. Yeah. Developer. Let me draw it on the board. That's so much easier. So we have 4 containers. We have developer. fixer, and water again. Okay, and that's inside our light box. Okay. Also nearby, we're going to have a timer. That's
so
my
the
timer.
water last one is the sterile water as well, yeah?
Yep. Yes.
All the
Sorry. Yep. We don't want tap water. No.
Yeah.
Not at this.
Well,
Not at this
purifiers.
stage. Okay. We have a timer on our bench. That's a timer. I'll write timer because it's not a very good drawing. And we have a thermometer. A thermometer. So
Thermometer.
taking a temperature.
oh,
Does everyone know what a thermometer
Of the
is?
water, yeah? Taking the picture.
That's
the
it.
Temperature of the water.
That is the worst thermometer. And a thermometer. Exactly right. Grace knows. Okay. So we're still not ready to shove actually our hands in the box and do that x-ray. Anyway, we need to get our thermometer and we need to test the temperature of the developer. Okay. Depending on the brand of developer you use, is that a developer? Yes, developer up there. The developer you use, you will get a time chart. We always try and aim around 22 degrees. 22 degrees, 4 minutes. Okay?
22
Yeah.
degrees.
That's what we aim for. However, we've got some leeway. So print it out next to this machine in whatever practice has this, will be whatever brand it is, how long you're developing for. Okay? How long you're developing for depending on the temperature of the developer. Okay? This is why the room is temperature controlled. It normally isn't connected to the same aircon that the rest of the building is, because it can greatly alter how we develop our x-rays. Okay?
What's the name of that machine? The machine we put on.
Just a light box.
Light box.
Light box, yeah. Nothing special. X-ray light box. So you do need to know this bit of information here. The developer is to chemically reduce the exposed silver halide crystals to black metallic silver. Okay? So the developer is the part that does the lighter images. Because you know x-rays are black and white. Yeah.
Developer is the part that does.
Yeah.
We don't have this in Teams.
So it's under the PowerPoint in documents. I'll show you how to get to it. Yeah. So what it means by also softens the film emulsion. Emulsion, to do something similar, is like a cream that's on your skin. It's washing that cream off the x-ray so we can draw that image out. Okay? So that's what they mean by it reduces or softens the emulsion. Yeah? So, who knows what the word agitating means? Agitating. Aggravating. So, agitating means shake like this. So, we're going to now get that film and we're going to agitate it for 20 seconds. So, let's pretend that we've got 4 minutes here. So, it's 22 degrees, right? 20 seconds. Oh, that's not even a word, Kelly. Seconds. We're going to agitate. That's a very important word, agitate.
So do you do that in the water or do you just leave place it in the water?
So we do that the whole time, that whole 20
In the
seconds.
water, is that up?
Because we don't want to go straight from developer to fixer and mix those two chemicals together. You're going to end up with just a pretty crappy image.
Agitate. How do you say agitate?
Agitate.
Agitate.
Agitate. Agitate's the word I'm looking for.
Not aggravate.
Not aggravate. Agitate. Agitate. We are going to agitate dance.
So is it 20 seconds every time?
Yep, so that's regardless of temperature or anything, 20 seconds every time. Now, when we get to the fixer, we want to have it in there for 10 minutes. So you're starting to see why your practices, have digital x-ray where you go beep, oh look, it's on the computer. Because it's a lot quicker, a lot more time efficient for your practice. Now, this is a long time. And your patient is sitting in the chair going, God, am I having a root canal or not? Where the hell are they?
Yeah.
So what we do here is something special. This is going to show us the light and dark images and fix it. So it's a fixer, it fixes the image. So after 3 minutes, I actually have my image. Let me just go get my little hook and I'll show you what I do. After 3 minutes, I actually have my image.
Alright,
So-
so what's 10 minutes, Kelly? And what's 3 minutes?
Does anyone have a film floating around that I handed around? Yep. So, oh, this one's in the packet. Let's pretend that this is oh, actually, hang on. I'll actually get one. So after 3 minutes, I can see the image and I can make a diagnosis from that image. So I would, so where's my dot? There's my dot. So I've been using this the whole time. Agitate. I've left it in there, set my timer for 3 minutes. I can now, I would take that to the surgery door and say, Dr. Grace. And Dr. Grace say, oh yes, lovely, thank you. And then proceed on with what they want to set up and do with the other nurse. I would then go back to my dark room, pop it back in. How many more minutes have I got left now? 7 minutes. I would then put it back in for the extra 7 minutes. Because if we had to wait, 15 minutes, yeah, it's a long time for the patient to be waiting. I mean, how many surgeries do we work out? We can actually see a patient in 15 minutes and get for a quick a toothache or something. So that's a big waste of
So,
time.
okay, Kelly. So,
Yeah?
Alright. Okay, what is 10 minutes?
So fixer, it needs to be in there for 10 minutes. Regardless of this step, we need it in the fixer for 10 minutes. But that's a long time for the patient to wait. A really long time. After 3 minutes,
After putting the film.
yeah, so
after
it's been
3
in there for 3 minutes.
yeah.
I've got my image. The image has been fixed. Sorry, it's not set yet. It's not hardened. So I would take it out.
If it's not fixed.
It should be by now. If it's not, then something's happened and we'll have to start again, unfortunately. So you would take it out, trot to your surgery door. Excuse me, Dr. Shima. Dr. Shima would have a look. Oh, yes, wonderful. Right, we're going to set up for a 3-4 root canal. They'll probably explain it to the patient. You normally, in this situation, have another nurse and you're kind of tag teaming. They'll come up and set up, and you'd go back and put it in for the remaining 7 minutes. Okay. Beep, 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 beep. 7 minutes are up. Are we finished? No. We are now going to agitate again for another 20 seconds.
So you agitate the film for 20 seconds.
Yep. Do you think we're done now?
Probably not.
No.
I guess so.
No. We are still not done. We need to now run that film in a water bath for 15 minutes.
Oh my god.
Can you see now why no many practices have this?
Yes.
Government dental does, but government dental see one patient every hour. Very slow, very steady. Okay. So, well, it says here 20 minutes, sorry. So 15 to 20 minutes. So a water bath can be basically, where's my box of films here? So you say we've taken a couple of x-rays. It's you've already probably caught on that dentistry is not environmentally friendly. And you think, oh, that's the modern thing because now we have to wrap everything in plastic and disposables. No, we weren't back then either. Before well, not me personally, I'm not that old, but before they even swabbed and things like that, we still wasted water. This will hang under a running tap for 20 minutes on a special hook.
20 minutes.
Yes, up to 20 minutes. It's a lot of wastewater. Yep. They do have special baths you can hang it on where the water goes around. It's still fresh water going down a drain.
But
So,
it's
yeah.
actually taking longer
Yeah.
than 20 minutes.
Yeah, so what happens if you have 3 surgeries and there's 2 of you doing x-rays next to each other and you both want to hang your x-rays in the water bath?
It's a fight.
It's a fight. Or you could label them. So we know, because we then have to come back later and we have to file these in their file in a special way that I'll show you as well. So after all this, we're all very exhausted doing this x-ray. We do need to file it. So what I always do, what everyone does, is we save that little outer packet. And while that's in the 4 minutes, I would write the date, the patient's name, the patient's date of birth, maybe the time, something, okay? Or PA, if it's a PA, or a bite wing, if it's a bite wing. As much information as you can, because you'll come to realise there are a lot of people with the same names as well. So don't just write their name. And that would
Name
go...
and date of birth will be fine.
Yeah. Oh, you'd be surprised. And I would put that on the corresponding one.
Just the phone number.
Yeah, phone number. draw a picture of them. No.
Write their life story.
Yeah, life story, which you always learn while you wait for the dentist.
Whatever you can, right?
Yeah. So that way I can identify who it is. Do you think we're finished yet?
No.
What do you think is the last step we need to do?
We need to
It's very wet.
let it dry.
We need to hang it to dry. So in our air dried
20 minutes.
do you know what? Sometimes I leave them till I get a next break, or I'll leave it to the end of the day when the patients are gone home and I'm packing up, and then I'll file it away. It can dry for as long as you need it to dry. You get some freeway there. So this will now hang in our temperature controlled dark room and dry with its name. So it's a long, painful process when you can just go like this, beep, oh, it's on the computer.
It's not for nowadays.
People are still using this. The young lad Traff that comes in on a Friday, our friend, our tall friend, the one I tease, come on teenager talk. He works in a practice that has one. What do they call him? The shy teenage boy. Let the shy teenage boy talk. He works in a practice that has one of these. Quite an older gentleman. Yeah. Government dental service. So when your kids get a recall next into the dental van or the clinic, does your children get the free dental? You get a letter from school?
Yeah.
Have a look around, you'll see one of them. Okay. Have a look around the room. They definitely have one of them. Not always in a dark room. They just use this as the darkness that they need, but it's because they're trying to save
I
money.
can understand what we do with the machine.
This isn't a machine, it's just a box.
Yeah, what we should do with the box.
So the whole stage that I just showed you, dipping in that, is actually
It's in the
done in here in the dark. Yeah, I just took it off so you could see. Does that make sense to everyone? And our vision is through this special red lid.
Which is covered or what?
No. This is enough
All the
light
room
protection.
covered like that? You can't open the lid when you're doing it?
No, because if I open the lid while doing it, I would expose, even in a dark room. Yeah, even in a dark room.
That red light will block the light.
It will. Yeah.
So how often do you have to change the chemicals in all the water every
Wonderful question, Nikita. Beautiful question. Daily. So she asked, how often are we changing this? Daily. Yeah. Also, you've got to remember I said the emulsion. This stage, the emulsion is loosening, so that can get a bit dirty and cloudy. So you monitor it during the day. So also in our room, above it, we have a lovely piece of paper. Get rid of that. We have a lovely piece of paper on the wall that all staff member will record how often it's changed, the temperature, and your signature usually. Okay, so temp, date, time, when it was changed. Everyone's different, however they want to do it. Okay, so always refer to that as well when you come in to do this. Okay, so quick quiz. The dentist has taken the x-ray. What are we doing? What's the first thing we do?
Pop into your hand
Yep, in our hands.
and then take it to your area and flick
Flick
them off.
them off.
Flick them off and put
Tear
it
it
into
off.
your
Peel it
hair.
off. Peel it off.
Peel it off and place it.
Drop it onto the bench.
Yeah, don't do this so the dirty wrapper touches the bench. No. Plop. Bin.
Wash your hands.
Gloves.
Put new gloves on.
Wash.
Done.
New
Clean
gloves.
gloves.
Good.
So
Then what are we doing?
Then you place it in the
Before we place it in the developer, we need to work something out.
see the temperature. of the
Temperature. Good. So first, let's write this down. So, Dara, you know me, I'm so repetitive. By the time you get to the test, you want to vomit from how boring it is. You know it all. Repetition is key. Okay, so first of all, we are I forget I'm videoing myself. Number one, we are taking to dark room. What a horrible pen I've got here. Taking to dark room. Have a ledge on both sides. Taking the dark room, tear plastic layer onto clean bench. Please remember, if you have a dark room that has an option of an on-off switch, the switch is off before you do that. Even if you're very, very busy, try and remember to make it the dark room before you do this. I say from experience. You go, ooh, quick, shove it in the box. Take in dark room, tear plastic layer on a clean bench, dispose gloves, wash, clean gloves. Woo! First step's a big one.
Oh yeah.
Okay, number 2, we're taking the temperature to work out the time. Okay, what are we taking the temperature of?
The developer.
Who's the developer? Yeah? We then will refer to our chart to know. We'll refer to our chart. So it was 22 degrees Celsius, so I'll go, 4 minutes. Has to be in there for 4 minutes. Okay. My lovely little clip. I can then place on the film. Whereabouts on the film am I clipping?
The dot.
The dot. Good job. Place film clip on raised dot. Always. Otherwise your x-ray has dots all over the shop. You don't know whether that's something to diagnose or whether your nurse has just been a bit friendly with her clip. Okay? It's Mumta. I just said to her, I'm doing a video now. She wrote, thank you. We shall video it back. Where is she? Hi, Mumta. She's watching live. She's watching live.
Where is my
You're welcome. She's at home today.
I think I'm watching.
Yeah. Yes. So this. Oh, that one's not streaming live. Actually, it's on my. I couldn't get it to work.
That's amazing. She's there.
Yes.
Where?
It-
At home.
Yeah. So you've got that option when you're
She
home,
doesn't
guys.
say anything.
No, you've got that option when you're home.
Yeah, like for example, when
And it actually, and then at the end of the day, it actually prints me out the printer who was present, and I attach it to the roll.
How to do that?
Magic! I don't know, my IT knowledge sucks. I press the button I'm told to press. Basically, computers are not my thing. Okay, so we've put it on the raised dot. Now what are we going to do?
Put it in the developer.
Yeah?
Clip on the
Developer. Then what are we going to do? No, no. I've put it in the developer. I need to
set the timer.
set the timer. Good. Set the timer. Good. Now we can do what? Shake our bottom. We can agitate it in the water for 20 seconds.
That's after it's 4 minutes past, isn't it?
Yes.
I
So
put it in the water or before we put it in the water we need to agitate?
So agitate it in the water. Shake it in the water. Yeah, we want to get the fixer off. Yeah, in the water. So let me pretend that this box is on top. I'm doing this. Okay. I don't normally set the timer for this because I can count to 20 seconds. I'm very clever. I can do that much. But it's up to you. Now I've done that, I want to do what? Put it in my fixer. So we've just done the water. Oh, I didn't add water. Will everyone understand? Sorry, I've just written too big. I'll do number 6 here. So fixer. Now our patient is losing patience. Is getting a bit bored sitting there. The dentist wants to hurry up. So what can we offer?
After 3 minutes.
After 3 minutes. Good. How do we interrupt our dentist? Because most likely they're talking about something. Golf or the costs or something. How do we do that?
Say,
Not.
excuse me.
Say, excuse me. Well done. We don't just walk in there. Yeah, I got it. Okay. It must always that professional. Depending on where you work, some younger dentists just go by Nick or Adam. But find out where you start working, whether they want to be referred to as Dr. Adam or Dr. Carol or whatever, okay, in front of patients. Lots of dentists I work for, that's how you refer to them in front of patients, but in the lunchroom you can call them by their first name and it's quite friendly. Okay, so always make sure of that as well. Just to divert. So we've knocked on the door politely and we've shown the image and he's made a diagnosis. So now what do we do with our film?
Wash it.
We've only had it in there for 3 minutes.
And
And
another 7.
place
Another
back in.
7 minutes. Good. So we need the timer here. Back into the fixer. Timer. Next step.
20 seconds.
20 seconds.
And
Agitate. Good job. It's a hard word, isn't it? Yeah, you said it. Good. Another 20 seconds. Agitating in water. In the water. Last step. Last step. No, second last step. No. No, before we dry it, we need to put it in where we need to drain the oceans. What do we need to do?
dark room.
In the dark room, what are we doing?
Running water.
Under running water. Good. A water bath.
For 20 minutes.
My notes today suck. I'm so sorry, girls. I'm like, woo. Water bath for 20 minutes.
Wow. It's 1 hour, just 1 hour for it, right?
Yeah.
Water bath for 20 minutes.
It's actually quite exhausting when the dentist, like I used to sit there and be like, he'd be like, I will just take an x-ray like third patient in a row, and I'd be like, oh! Because also sometimes you're on your own and while you're waiting for 7 minutes, you've got to run back to the room because he's wanted to set up for a root canal, and you'll set that up, then you'll go get your x-ray, and then you'll go back, then you hear the timer, clean hand, dirty hand, wash, 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 then you're running back. That's why I used to be so skinny. Not anymore. So water bath for 20 minutes. Good. So we've missed something along here. What's something I could be doing? Good job, Felicia. So while we're waiting for even the 4 minutes, timer even in here, the patient, now we know that PT stands for patient, so if I ever write PT, I'm writing patient. Another way I could write patient is PX. Okay, so if you see that written down from me,
PX or patient.
yes?
What is X?
I don't know.
PT is, it makes sense,
No,
but
PT
Yes.
is confusing with PPT, you know.
PPE. Yeah, so if I ever write either of these, I'm talking about the patient. I usually write PT, but we'll go through abbreviations as we come across them. So patient details. What layer of the X-ray wrapping would I put the patient details on?
On the outer layer.
Outer layer. So what happens if your surgery doesn't have that extra barrier that I used to plop it on the bench and put in the bin? What if they use that as their protective layer and I've put it in the bin? What's something we could use?
Disinfectant.
No, I'd keep it in the bin.
Oh.
Yeah, so we have some waterproof type sticky notes and stuff that we would put on the other side. A plastic label, and we'd use a permanent marker to write on it. Okay. Good. Now the next stage we can leave to the end of the day, and that's our drying stage. Isn't it? And that is our drying stage. Next to the label. So the rest is pretty self-explanatory. I'm not going to bore you with that. A dark room has to be dark. We don't want any light to come in. Okay. So what is the time? What's the time, please?
12:30.
Yeah, I think it's definitely time for a break before you all fall asleep on me. So when we come back, we're going to sit in our groups, please. And we're going to have a play with our manual x-ray boxes. Okay? Yeah.
Time, temperature, date, time, and what's the other word?
What did I
Time
write?
sheet. Temperature, date, time,
Changed.
change.
Yeah, changed. So, yeah, I had to think about that.
You were like, you can read your own writing.
I know.
That's like me sometimes I like to watch.
So I'll do this a bit neater while we're at lunch. So go have lunch. I'm gonna write this later. Yeah.
Oh, are you guys doing green tea?
Yes, please.
Have a lunch there?
Yeah.
Or you're gonna have
And then shake it. Yeah. Shake it. Agitate the whole time in the water. Thank you. You're welcome.
you driving? Oh, sorry.
Do you want milk tea? You messaging me because I don't have a lunch.
I'll just send
Oh,
you
you
guys
want
the money then. Oh no, I had my chai latte. No, I won't get it.
Oh,
No, I'll get it tomorrow.
Okay, okay, like ginger or one.
We're gonna go.
Treat yourself, Nikita.
I'll get it tomorrow. I had a chai latte.